Hi all. So this week, the readings that we covered going over sex offenders and sex offender treatment uh, were interesting to say the least. I will personally say that I do have some bias when it comes to sex offenders. This is mostly due to the fact that I used to work for about 3 years at a child advocacy center in which they did forensic interviewing, trauma therapy, and provided medicals on children that had been usually sexually abused, but also that included some neglect cases as well as severe physical abuse. So, due to that, I really struggle when it comes to this population. But after going through the readings, the PowerPoint, and everything, I feel like more information is needed in terms of treatment for sex offenders. I feel like there's more research that's needed. Um, my viewpoint really hasn't changed so much on sex offenders, but I believe that for treatment, just the fact that there hasn't been a lot of positive outcomes, it's not being found to be super effective, is a bit concerning. So I think going towards more individualized plans in treatment would be better. I know it states that in the PowerPoint that, that's something that we need to be looking at is being more individualized for adult offenders as well as juvenile offenders. I also think that if more research is done, especially maybe looking at doing an ACEs study with sex offenders, we would find that there are a lot of sex offenders that themselves experienced abuse, neglect, family conditions that were not optimal, and that may give us a little bit more insight into this population and into their psyche and how they are functioning. Um, that's just my personal opinion from looking at research on ACEs while I was working at a child advocacy center and seeing how trauma can affect a child's brain, since the children that we saw there had experienced a great deal of trauma. So I just wonder if that holds true also for individuals that are sex offenders. You know, if looking back, they've experienced a lot of trauma themselves. I think that'd be really interesting. The other thing to note with sex offenders is that victims are usually someone that they know, um, which is a bit scary to really think about. And I know, like, the children that we would see at the advocacy center, pretty much all the time it was someone that they knew that had victimized them. So while my views of sex offenders have not changed, my view on sex offender treatment has changed a bit, as I think it is necessary beforehand. Um, it kind of aligned with what is said, in which that, it's not being shown to be super effective. But I think more research into this area might help with that to make it more effective if it's a bit more research and evidence based. I think that could really help. And I know it says that you're looking more at rehabilitation than a cure, and I think that's the truth, and you need to go into thinking about sex offender treatment with that mindset as well. So that's pretty much all the thoughts I have on this. Once again, I do hold some bias. um, it's something I need to work on personally, and I know that for a fact. So that's it.